Hello everybody, my name is Isabel Sanchez and today I will be informing you on how to place braces or how braces are placed. Did you guys know that archaeologists looked back and found that ancient Romans were one of the first civilizations that were found using braces, and they would use little gold wires and bands to kind of adhere the teeth together and straighten them out. Before we get into the how braces are placed, we do have to understand what type of brackets there are and types of orthodontic treatment there is. So there are two types of brackets that are most commonly seen in the orthodontic field, and that is the traditional metal brackets or the ceramic or porcelain brackets, which are also known as the clear brackets. Of course, there is another option, typically this option being straightening the teeth with clear aligners. There are many options when it comes to picking out what type of provider you want that's going to provide your aligners for you. We have Invisalign, we have Spark, we have ULab, we have Smile Direct, although we don't recommend those online websites. Go see your orthodontist. However, today we're not talking about aligners, but I did want to mention them since they are a part of orthodontics. We'll only be talking about brackets today. So, the first step into placing your braces is going to be cleaning off anything that might be on the surface of your teeth. That means any old food, any soft plaque, just really anything that can potentially prevent the brackets from adhering properly. So what we go ahead and use is a Profi angle, which is seen on the right. It's that little brush-like cup thing. And we also use a Profi paste. This Profi paste has a sandy, grainy texture. Usually they ask you what type of flavor you want it. They offer it in bubblegum, strawberry, blueberry sometimes. I would say that's the craziest flavor I've ever heard of. And sometimes it's just plain. It basically just tastes like gritty nothing. But yeah, basically that pumice just brushes off all of the nasty stuff that might be on the tooth. Next is going to be our preparation process. So this preparation process is considerably the most important step of the entire process itself. This ensures that the bracket sticks onto the tooth really well. So without it, they would just slide right off, and we do not want that. So what you see here on the left is etch on the tooth. The etch is that blue little gel. That is a low-grade acid that essentially dehydrates the tooth. And then what you see on the right is the application of the bonding agent or a sealant agent. This again is just another step towards making sure that the bracket properly glues onto the tooth the way that it should and does not fall off unless we take it off or unless an extreme amount of pressure is applied. Now comes the fun part, the brackets. So after we've done the etch and the bond, now we're able to place the brackets. So the assistant, also known as me, will grab one bracket at a time and apply a small amount of glue or cement onto the bracket, press it in and pack it in to make sure that it goes into the bracket all the way, and then we just apply it to the tooth. At this point, the bracket still isn't completely set on the tooth, so it's still able to move around. We place all the brackets depending on what orthodontic office you visit. Some offices apply only the top braces first, some apply top and bottom, some apply just the first 10. It really just depends on what your provider prefers, you know. Um, so, yeah, at this point, the bracket is placed on the tooth and the glue is still wet so that the doctor is allowed to move the bracket around and position it to his prescription or how he decides to move the tooth and what angulation he's going to move it in. And it isn't until after the doctor comes and moves all the brackets into the proper positioning that we're able to light it with our UV curing light, which is what's seen on the right picture. It's that little blue light. It's pretty strong for, I guess, a low grade UV. It does get a little warm, but again, this is what's going to make things semi permanent but permanent to the patient. And it's not going to allow that bracket to budge after that light is set. Now that the brackets are properly cured onto the tooth and aren't moving, as mentioned, now we're able to apply the wire and the color tie. So the wire basically holds memory and tells the teeth where to move and how to move. So basically, the wire assists the brackets in straightening the teeth. And in order to hold this wire in place, we have to place what we call color ties or elastics. There are a bunch of different names. I've heard A's, I've heard color ties, I've heard ties, leg ties. It just depends on what office you're at. But most offices do provide a variety of colors. So that's what those little colors are on the brackets. They're basically to hold the wire in place. And it's pretty fun. We get to let the patients pick, we get to let them swap them out. We get to have fun with it. Now, what to expect. So, some habits to get into is brushing 3 times a day, ensuring that you're incorporating all the little brushes that we provide, incorporating flossing with traditional floss, and of course, staying away from anything hard, sticky, or chewy. In conclusion, now we know what types of brackets are offered, the step by step process of placing the brackets, and just some brief expectations and habits to get into. Lastly, I hope this little informative speech made you smile, and I hope you didn't check your teeth too often. But I do want to say thank you for taking your time to give me a listen, and have a nice day.